Go, Mike.
All right. Good afternoon, everyone, and welcome to the 7th Community League COVID-19 virus pandemic. As usual, I'm Mike Wilder, the Director of Emergency Management. We have with us today Judge Executive Howard Hunt, Mayor Mike Perros, and Boyle County Health Director Brent Blevins. We want your questions and comments today, so please feel free to use the number. It's on the front of this briefing, 859-936-6865 to call with your comments or questions. We want to make note of something today that we'll be doing in the future. We have decided that one briefing a week should be able to update the community as to any new happenings within the pandemic at this point in time. It seemed to be getting just a tad bit on the repetitious side, so we all concur that once a week is sufficient enough to disseminate any information that we may need to send out. We will let you know that should something come up, some important bit of information, that we could schedule a streaming at any point in time. So, but as it is right now, our next briefing will be next Thursday, April the 30th at 3:30 p.m. So please write that down and keep it with you should you want to join us. A couple of things that I want to bring up to the group and make it known to the community that we have been working on a temporary housing agreement with Center College to be able to put our emergency medical services staff, our ambulance service, in a safe place that they could practice self-distancing during the 24-hour shift that they're on. Center was able to accommodate us on that. We had an agreement drawn up and it was put in place on the 20th of April. I want to thank County Attorney Chris Herron and Center Legal Counsel Jamie Leahy for their work on the agreement. It is in place and I might add working very well. One other thing that I want to make mention of, and I have done this before, but I think we need to do it again. Since a nationwide emergency declaration was issued by the president on March the 13th, 2020, it enables the Stafford Act to become active in this pandemic situation, which simply means that FEMA is authorized to provide emergency protective measures not authorized under other federal statutes, including direct federal assistance under the Public Assistance Act at a 75% federal funding. We have a public assistance request that has to be filled out by any entity that feels that they have incurred expenses during the COVID-19 pandemic that would warrant them to be entitled to reimbursement by the federal government. Eligible activities are very simple. They have to be activities performed to save lives, to protect property and public health and safety, or to lessen or avert the threat of a catastrophe in the designated area. We have several entities that have already filed this form. I have sent the form to them. I have them in my possession. Should anybody out there feel that they qualify for this, please get in touch with me and I can be glad to send you a form to fill out. Now, this doesn't guarantee you anything other than the fact that you're pretty much just putting your name in the hat to be considered by FEMA to be eligible for reimbursement at a 75% federal funding. So please, if anybody has wants to file for this, I'm glad to do it. The email that it needs to be sent to is this: pa.help@ky-em.org. Again, let me give it to you again. This is all lowercase. pa.help@ky-em.org. That is the recovery branch of the Kentucky Emergency Management. They are the firm and the body that will be coordinating all the activities under recovery in which this takes place. Also, when you email that form in, copy me on that, so I'll have a copy for our local files as well. Again, we have everybody on board here. Judge, how about you making a few comments?
All right, love to, Mike. Thank you for that good information. I always like to try to come up with a couple things new each and every meeting that we have. And I'm going to read from you a April 4th, 2020 Kentucky Public Health guidance on cloth face masks for information. It's simply meant for information for people that are using cloth face masks. In a setting where essential activities make social distancing more difficult to maintain the distance, CDC advises wearing a cloth face mask may help reduce the spread of COVID-19. 2, cloth masks do not have the proper design or necessary materials to filter out virus particles and therefore do not, underline not, ensure you will not become infected with COVID-19. 3, wearing a cloth face mask may, however, reduce the risk of someone infected with COVID-19 unknowingly spreading the infection during the period of time after they have become infected, but before they have developed symptoms, probably 2 or more days. 4, short one sentence, when wearing a cloth face mask, you must not touch your face. And 5, when wearing a cloth face mask, you must still maintain social distancing. I thought that was good refresher information as it regards Kentucky Public Health guidance on cloth face masks dated April 4th, 2020. I've received information from our county clerk, Trilly Bottom, that I looked at and I thought it was really good. It's kind of a different twist on things dealing with the coronavirus. And very briefly, it's from www.psychology.org today, which is now a link on our Boyle County coronavirus website links. And it has 5 expert tips for dealing with coronavirus anxiety. And I'm going to read these real quickly, and I hope everybody that's listening and watching can go to our link and get a copy of these tips to help them and their families where they are. Number 1, limit social media and news consumption. Continuously reading fear-inducing information can seriously affect both depression and anxiety. The writer encourages the public to limit their news and social media consumption to less than 30 minutes each day. Another writer to the article, a licensed mental health counselor who owns an online therapy practice, also emphasizes the importance of limiting time spent on social media. Studies have been done showing an increase in anxiety and depression symptoms when more time is spent on social media. 2, focus on what you can control and let go of what you can't control. We've heard that many times throughout our lives. One of the writers, an associate licensed counselor in Birmingham, Alabama, stresses the importance of understanding the difference between what we can and cannot control. With the coronavirus epidemic or pandemic, people should rely on recommendations from trusted media sources to minimize their risk. Find out what you need to know, then move on. As many regular activities as possible. The coronavirus cannot and should not be your only focus. Good tip there. Make use of technology. We're using technology in this meeting right now. You had FaceTime and Google Hangout, Skype, Zoom, the other ones. This allows people to socialize with their friends and family without leaving home. Make use of technology. Using technology to uplift loved ones who might be feeling especially far removed from the family right now, or check in on elderly family members who may be isolated because of their age or health conditions. FaceTime them. Talk about something other than coronavirus. Number 4, stay busy. Distraction is key to avoiding anxiety associated with the COVID-19 outbreak. Tackle some chores that you've been putting off. Keep your space tidy at home. And number 5, stick with a schedule and establish normalcy. Since most people operate on a consistent schedule during this time, they should adapt the schedule to meet their new restrictions to establish a sense of structure, according to the law. We grow bored and increase the likelihood of feeling depressed or anxious, but remaining productive can provide us with a sense of normalcy. So this is all simple, good tips to help us with dealing with coronavirus anxiety. I just thought I would throw that out for public information and knowledge. And I had a little radio spot this morning on WHR and Joe on the Joe show, and we talked about how pleased I am from my perspective, and I'm sure the mayor is too, on how Boyle County is responding to all those stated requirements from the governor, from the president, from all those up and down the line of leadership to help us keep the county as safe as possible. I think it's had a great impact on us having, I think as of recently, I might be wrong on this, Brent, 16 confirmed cases, but of that 16, if I'm not mistaken, correct me, 12 are recovered and 2 are brand new. So if I'm wrong on that, Brent will correct me with updated information, but all that points to my deep appreciation for all Boyle Countyans being responsible to doing the right thing during this pandemic response. Thank you. Thank you, Mike.
Judge, thank you. Appreciate it. Those are some good comments. I know a lot of people have began to do things that they hadn't done in years. I've heard of people that are playing Monopoly again. Families that are working puzzles together. All of those things you haven't done for years. Played checkers. I had a cousin that's played checkers. He was an excellent checker player, but hadn't played in years, and they've started playing checkers. I thought that was pretty neat.
Absolutely.
But that people are doing. So, all in all, things, we're going through a very difficult time to say the least, but some of the things we're doing to take care of that are pretty heartwarming as well. Things that we haven't done for a lot of years. I know families are spending a whole lot more time together. That's a good thing. So hopefully we're going to get through it. We will get through it. We'll get through it together. Mayor, how about you? You got something to say?
We've got some green light bulbs left. I think that has been an interesting program. It's almost 6,000 have been distributed out, and last count was over almost $8,000 in charitable contributions. So that's a good thing. I did just get off of a Zoom phone call with the governor's office. And everyone there in that cabinet is thinking forward as to how they're going to open the state up for business again. I think there's been several different methods floated for doing that. Personally, I'm just pleased that they're talking about it and actively pursuing their plans for that. One thing that I did pick up that I think we all need to be prepared for is when they do lift this shelter in place order, there's probably going to be a mandatory mask order. I don't think they're going to play around with that. If you don't have a mask, there's going to be some legal repercussions, and that's a different thing.
A lot of people are wearing masks now. I think it's beginning to catch on some. It really is. But I'm like you, Mayor. I think that will be mandatory. It will.
Yes, sir. Yes, sir. That's all I have.
Brent, how about yourself? What do you got for us?
I am here. I apologize. I just can't get that webcam to go today, but I'm here. All right. Here's what we've got. I'd like to echo to what all you guys have already said. I really appreciate the community. I appreciate you guys' leadership and what we're doing and where we've been and where we're going, because that does make a difference. Particularly, Mayor, where you're talking about the businesses, it is good that we're starting to look at that and getting some plans together. I would just reiterate to all the businesses, be patient. We'll get our plans together. And as difficult as it was to get into this, it's going to take us a little bit of working with the businesses to help everybody understand, here's what you got to do, that kind of thing. Some general things businesses can think of right now, not saying you're opening tomorrow, but just think of this. When you have to open, or when you open, you have to be able to ensure social distancing, regardless. That's just got to happen. So if you're already doing some practices now, such as your people are waiting in the parking lot until you text them to come in, probably a good thing to keep that going. Those kind of things are what's going to be a difference as we do this. Judge, you were close on our cases. We've got 18, and here's what happens on that. Last night and this morning, we got 2 more, but they were both related to each other in the same home. So we knew after we got the one last night, we knew the one this morning we were going to get back positive, and they're doing what they need to, and they're quarantined in their home. And as most of our people have done, and we're really glad when families are able to do that. So, and we've also got some people in the community who have stepped up to help some of these families that needed some food and some different things like that. And I'm real proud of how this community steps up for that. That's really good. It's, the Boyle County schools, United Way, both helped on that. And I know the Danville schools will help when we get to that point and as needed. So it just makes a difference. And it makes a difference to these people who are in quarantine right now, dealing with the virus, but also just thinking, I need a little help. And so I appreciate all those people doing that. Here's a couple. Oh, sorry there. A little bit of information, because I've talked a lot about long-term care, and that is where we are doing a lot of focusing. Now, the virus is still in the community, and we're still going to see cases as they come and go, which is a good thing. But for long-term care facilities, let me give you some numbers on just Kentucky. As of yesterday, we have 62 long-term care facilities in Kentucky that have at least one case. And that comes out to be about 500 in the long-term care part. Actually combined right around 800 total cases with 77 total deaths. So you're including nursing homes, assisted living, long-terms in terms of prisons, those kind of things. But that at least gives you an idea on what the numbers look like for that in Kentucky. So, our local long-term facilities here have done a tremendous job preparing for this. The leadership we have in these agencies is tremendous for us. And I really appreciate what they've done and how they've worked on that. But that's why you're going to hear me talk a lot about long-term care over the next month, because we're trying our best to protect those vulnerable populations, and including the staff who work with these people every day. Out of the 18 cases, I didn't say this, we have 13 cases now who are off quarantine, meaning they have done their 14 days and we are no longer following them. So out of that 18 cases, we are down to 5 as of right now that we're following. Now, those 5 all have contacts with them, so it's not just 5 as the total number. There's a lot more, but I'm really, really pleased with that. We have people who have gotten through the process. They feel better. They're able to be back out in society, whether they're working or whatever. And I think that's just great. I'm really proud that we're to that point. And we've had a lot of families really work hard to get to that point. So that's something to look for or to look up to. Just a couple more things on my end, and then
Looks like we've got about 5 questions, Brent, as well. So
Sure, let me scroll down and look. I'm glad you said that. I totally forgot. All right. There's one. One is, how do you get the light bulbs? And that is, oh, Mike, you'd already done the city hall on that. I think I'm missing, let me click on my chat again. Maybe I'm missing the other questions.
No, they're all I see is those related to the light bulbs. And you
Yeah.
can call City Hall at 238-1200 to get more information on about where to get the green light bulbs.
Yeah,
Okay.
that's what I see too.
those are just responses. I hadn't gotten the chat. I was just looking up and it said 5 up there, and that was responses from that. But there was another question too.
Okay. All right. Oh, sorry, Mike.
I'm trying to pull it up here.
Well, let me say, while you're looking at that, let me talk about one more thing I want to talk about for us as a community. And that's stigma for either businesses and or individuals who actually come down with COVID-19. And now I don't think this has been a huge issue around here, but just keep in mind that when an individual gets that, it's through no fault of their own. They picked it up somewhere, and now they're having to deal with the virus. And also businesses. You know, as we start having, or we've already had employees who are working places who turn up positive and it ends up on social media somehow and people figure that out. Just keep in mind that as far as I know, nobody out there is trying to do anything that is putting any business or anybody inside a business at risk. As far as I know, most everybody's trying to do the best they can not to get this thing and to kind of go through the process. So I just wanted to talk a minute about stigma and just instead of having any kind of stigma or bad thoughts towards these places, let's keep them in our thoughts and prayers as they work through the plans and the things that happen when an employee or somebody living in a business comes up with COVID-19. Because it's just important that we support everybody. And we've been great. This community is great. I can't complain here at all, but just wanted to mention that.
You see, are you able to pull that question up, Brent, now?
Let me look down here and see.
I've got it pulled up.
It's up right now, Brent, and the crux of it is the last paragraph.
Okay, the part about the profile on the cases.
Yeah.
Yeah. Yeah.
Well, what I'm looking at, can anyone explain why he, being the governor, is concentrating in an area with so few cases? Or does the governor think that folks are just not being tested? I don't know how to answer that one.
All right, let me look here. About known Kentucky deaths are about, oh, I see, on African American, expanded with significant focus on African American communities. Okay. I'll just tell you, I don't have an answer from the governor. I just don't on that one, why he's focusing, other than when you start looking at the percentages, And, if one group is looking like, man, there's a lot more cases or there are worse outcomes for a particular group, then, as on the epidemiology side, we start looking and trying to figure out, okay, is there a reason for that? Is it lack of access to healthcare? Do we need to test more, get more resources to whatever that group is? So that's my assumption on that. Now, the testing thing too, the testing will just kind of keep growing as we go through this process. Now, for us here in Boyle, we've been fortunate because Ephraim and a couple of private doctors picked up testing almost 2 months ago, whereas there's some communities who are just now really getting going on the testing. So we've had that capability for quite a bit, which I think has helped us to identify where we are as a community. Yeah, on the governor's thinking on that, honestly, I just don't know. Other than we're trying to make sure any population that looks like it's having a higher sickness or death rate, that, how do we address that as quick as we can?
Have you gotten any numbers, Brent, on the testing numbers about where we are on that, especially since we've opened up the drive-throughs at several different locations statewide?
I just don't yet. I do hope to have that maybe within the next week to give people more of an idea. I think the general assumption now is there's a significant, or there's more people that have been infected than we even know that will probably never be tested. It's just kind of how this thing works. But hopefully if we can get those numbers, at least it helps people around here to understand, oh, okay, we've done this many to do that. The problem is we've now got so many private labs that are doing them, whether Ephraim's using a lab or the private doctors. And that's been quite a process. And it's just hard to know what those numbers truly look like.
It'd be interesting to get a number on it.
Yeah, and I will work on that.
I hope the public understands the more testing we do, the more our numbers of positive results will go up. I think that's a natural cause and effect situation. But we will also know what our negatives out there are too.
You're exactly right, Judge. I'm glad you said that, because our numbers will go up, and that's just part of it. It's part of how this process goes. But as you've seen, or as all of us have seen, we've been able to flatten that curve pretty good, and that's what's allowing us to even have conversations about business going again, and how we'll do that and how we'll get rolling. So that's encouraging for all of us.
Absolutely.
I don't see that we have any more questions to come up. Brent, you got anything else for us?
I'm good. I appreciate everybody continuing to work. It makes a difference.
Judge, how about you?
I'm likewise. I appreciate everybody continue to do as well as they have done. I appreciate it. And as I always try to say is, let's be prepared, be aware, don't be scared. We'll all get through this together, and we're one day closer to being back to normal.
I think the mayor's already checked out on us, but we're going to do that. We're going to check off here as well, and just make note, if you're following us, that we will be right here next Thursday now, a week from today, at the same time at 3:30. We're only going to do one a week now for a while, and see how that works out. So please join us. Thank you.